Patients who are suffering from a variety of ailments will seek out traditional Chinese medicine to see if that will help them. As far as a cervical herniated disc is concerned, I wanted to find out from Sandy Lussi, who is a traditional Chinese medicine practitioner, what this can do for the cervical herniated disc. I'm so confused with this acupuncture, traditional Chinese medicine, herbs. How do they all tumble together, and how do we sort that out?
Every state in the U.S. has a different licensure title for acupuncture and Chinese herbs. In New York State, we're called licensed acupuncturists. In other states, you might be called a doctor of Oriental medicine, or they're just different initials. So even though we're licensed acupuncturists, we are also certified in herbs in New York State. There's no separate herbalist degree.
So what is traditional Chinese medicine?
Traditional Chinese medicine is a term that incorporates acupressure, acupuncture, and Chinese herbs. It helps the free flow of qi and blood in the system. This is what the Chinese have, the qi is what the Chinese have labeled the force that creates flow and helps to disperse stagnation, which is what cervical pain, or any sort of joint pain is in Chinese medicine. It's called stagnation. So that when we insert the needles, we're trying to get the blood and the qi to move more freely.
And does that mean reduce pain? I mean, is it really another method of reducing pain?
Right. So that's what it's doing. It's getting the when the needles are inserted, the white blood cells move in the area and get and allow the muscles to relax and help the whole area to relax. So that's how it helps to reduce pain in Western terms.
So, you know, in my terms as a surgeon, I sort of think very mechanically. There's this herniated disc, it's putting pressure on the nerve, and it's giving you symptoms down the arm. I love the idea of Chinese medicine, but I'm not really sure how is that going to affect this pressure on the nerve. Like, why would I go see a traditional Chinese medical doctor if I have that going on? Or maybe I wouldn't, I don't know.
What the acupuncture does is helps to release the area. When a person has cervical disc pain, it's caused by the inflammation, by the stagnation, the Chinese would call the inflammation in the area. So the acupuncture points help to release it, help to relax it. It's not going to cure the herniated disc, but it's going to help to release the pain caused by the herniated disc, and the tingling and the numbness.
The bottom line on traditional Chinese medicine is, if you're not suffering from crazy acute pain or having crazy weakness or numbness in the arm, and you have more of a chronic problem with neck pain with some arm symptoms, I think you would be a good candidate to try traditional Chinese medicine. Certainly no downside. And this involves acupuncture and massage. And as far as the herbs go, you have to be very careful with what they're giving you. I can't endorse taking herbs because I don't know what they are, and they're certainly not FDA approved. But I like the idea of traditional Chinese medicine. I think if I had an ailment such as a stomach problem or headaches, I would definitely seek out that as part of my treatment protocol. But with cervical herniated disc, you have to realize the limitations this has. It's not going to change the disc that's pressing on the nerve. But if you have a good practitioner and you want to try it, I think it's fine.